The future is here and now. We have the ability for our pets to be able to communicate with us through wearable pet technology. And this allows for early detection of health problems, for optimization of health, and ideally keeping them out of the vet clinic to begin with. And I spoke to Guillaume Coelho, who is the CEO and founder of pet technology company Maven, to discover more about this pet health revolution.
Guillaume, welcome along to the podcast. I'm really excited to be talking about a technology that I've been kind of looking at from the sidelines, if you like, for the last few years, but it's something that's really developing. So yeah, great to be joining you and having this interesting conversation, which I'm sure it's going to be.
Yes, thank you, Alex. It's a pleasure to be here. Always happy to talk about how we help pets with technology. So thanks for inviting me.
So we're talking about wearable tech, and there's a couple of kind of secret sauce bits that you've got up your sleeve. But before we kind of dive into the nitty gritty, I'd love to know what drove you into the pet wearable space, because I think you've got quite a personal story about the realization of how powerful it can actually be.
Yeah, it's true. So first of all, I grew up with pets. I always had pets. So first of all, I don't know what life is without pets. Okay, and yeah, my background is engineering, biomedical engineering actually. So I always felt eager to do something in terms of technology to improve the life of our pets, right? And personally, I have a history with one of my pets when I realized too late that something was wrong, right? So the moment I realized something was wrong with Tommy, which was a lab mixed with husky, a big breed, slightly obese, that was getting older, was when Tommy was barking at me so I could help him stand up, right? And so obviously at this time, there's like nothing you could do. I mean, I took Tommy to the vet, severe joint problems, and I mean, just deal with it, right? And pay for it. And so I couldn't came across the thought that I should have been able to detect early if something was wrong, right? I'm pretty sure there were signs at the time early on, like 2-3 months in advance, that if I was like paying attention or if I have some sort of technology, I could have been able to detect those early on and treat them early on, right? And maybe the outcome could have been different, okay? And so that's like the genesis of Maven, and what we've built today is precisely like leverage technology, leverage data to pinpoint early when something is wrong with a pet, right? So we can understand early on and tackle that issue like day one.
Yeah, absolutely. And I think that's even when you know, so you kind of been speaking to you before, you were aware that this was a potential issue with your dog and you knew what to look for, but even then it kind of crept up on you unawares. And I'd probably say actually with the options that are available now, you may have got it months, even years in advance compared to, you know, when you were tackling that problem.
Yeah, for sure. We know pets don't talk, right? And we know as pet owners, we struggle with trying to interpret our pets, right? We don't know if they are okay, if they are in pain, if something is wrong. And the best way to help pets communicate, it's through technology, right? It's through wearables, through other sort of devices that we can get a better sense of what's going on with the pets, right? And we know that they are very good at disguise when something is wrong, right? Particularly cats as well. And so being very granular and being able to detect like these incremental changes that happen on a daily basis, it's like a crucial step towards being proactive on our pets' health and well-being.
Yeah, absolutely. I mean, from my point of view as a vet, it can be incredibly frustrating because I'm seeing my patients when they're often brought in at the very end stages of their disease, and that's not a criticism of all of the pet parents out there. It's incredibly difficult. Our pets just get on with life. They hide their illness. They still eat. They still want to chase the ball if they're even remotely able. And so these signs can be very difficult to pick up on. And then you've got the fact that you're living with them every day, and so that slow progression is just really bad. And then that gets to a stage a bit like your situation, where the options available are maybe not nearly as good as they would be even a month or two in advance. And you know, I think there's a lot of comparison with human healthcare in the veterinary field, but our doctors are very lucky because we'll go to the doctor personally much sooner than we'll notice a problem in our pet. And like I say, that's not a criticism. So with this technology, so we've said wearables. I guess the most common comparison is with the Fitbit, with the step tracker, but it's so much more than that. What are we talking about when we're talking about wearables?
Yeah, so maybe it's not just an activity monitor, right? So I mean, we do measure the amount of miles, kilometers, whatever it is, calories burned. I mean, those things are relevant, but they are actually more relevant for the pet owner than they are for, like, clinically speaking, about the health of the pet, right? So
Yeah.
Maven is unique because we because of our position in terms of technology, we can be very granular on the data that we collect about the pet, right? So we have like hundreds of features that map out what's the normal behavior for that pet, okay? Throughout the day, throughout the night, different access, different intensity, different levels, how fast the pet goes between levels from minimum to maximum, things like that. So it easily gets complex. And each pet is a pet, right? So even the same breed, the same age could be entirely different depending on the pet owner, depending on the lifestyle. And so we have like a pet specific approach, and we've built algorithms capable of detect changes on each pet behavior, right? So we learn what's normal for each pet, and then we proactively look for changes on the pet behavior, right? And changes could be things simple as the pet being like less intense in the movement, okay? So if it's an eight-year-old pit bull, for example, and suddenly the movements aren't as intense as they used to be, okay, most likely this pet could be dealing with some sort of osteoarticular problem, right? Could be signs of the pet being restless in the middle of the night. So the pet is dealing with discomfort or waking up more often to drink water, whatever it is, right? And so our goal is always to detect changes on the pet behavior, okay, that might have a clinical meaning of what's wrong, right? And then it's not only the hardware. There's also a mobile app where we keep asking questions, and then there's virtual checkups. There's a Maven journal where the pet owner also inputs relevant data, okay? Because a pet being lethargic could mean all sorts of things, right? But then we know this pet is diabetic, or we know this pet has allergies, or we know this pet is senior, and that leads to different outcomes, to different diagnoses, right? And so it's like Maven is the most comprehensive data structure or data collection for a single pet, and the goal with it is to reach some sort of certainty of what might be wrong with that pet, right? And act the moment we know that.
Cool. So you mentioned there kind of, are they lethargic or their activity levels, but is it able to determine, pick up the different movements for different activities? So I'm thinking, when it's eating, or when that dog's drinking, or when they're scratching, because they're all presumably quite different movements. And yeah, it's not just measuring just solely activity or steps, if you like.
Yeah, so because we are very granular on the data, because we have like these 100 features to map the pet's behavior, we are doing some tests precisely to be able to detect those changes, right? Scratching is a very intense and quick movement, okay? And our preliminary test tells us that we can easily detect scratching, right? And so as we have more scale, we do want to label more specific behaviors such as drinking, eating, as you mentioned, right? So today, from those 100 features, we map like deep sleep, quiet, active, excited, running around, playing, whatever it is. But we want to be very specific, because like eating, drinking, and scratching are super relevant in terms of clinical validation,
Yeah.
right? The same thing for respiratory rate. Okay, so I have enough data and I'm granular enough to detect changes when the pet is at sleep, like midnight, pet is completely still. Okay, I can detect slight changes on the sensor that from which I can then extrapolate respiratory rate. Okay, and that's huge for pets to understand the pet, right? So I don't need to be like 100% accurate on the value for respiratory rate. What I need to be looking for is changes on that pet, right? If suddenly a pet is around 20, 22, and suddenly goes to 27, 28, okay, so that's something we should look into. And so that's our approach always in Maven, is like building evidence from data that something is wrong with this pet and what that might be.
Yeah, and an example of how useful that can be, you know, with that respiratory rate when they're asleep. So a dog that's in heart failure, actually sleeping respiratory rate is an incredibly accurate and valuable tool that our pet parents have. It can be a bit difficult to get that consistency of when they are in deep sleep, but you're right, just picking up a very slight increase. So the cutoff that we use is over 30 per minute, but actually for that specific animal, it may be that change from 18 to 22 is significant, and we can jump in with, you know, modifying that treatment plan at a much earlier stage than the dog coming to us when it's gasping for breath because its lungs are full of liquid. So that is, you know, incredibly powerful. And then the you know, being awake at night, we've got a known allergic dog. Well, the chances are, I mean, there's a number of other things, but they could be scratching all night, and you might not see them as a pet parent because you're out the house in the day, but in the dead of night when they don't have all that distraction going on and they suddenly feel incredibly itchy. So yeah, how powerful this can be for a whole number of conditions. So I guess from that point of view, it's not just our arthritic dogs or our heart failure dogs or our allergic dogs that could benefit from this. It's all kinds of different dogs with different conditions, but presumably as well, Graham, those actually that are healthy, so that we know that they're staying healthy.
Exactly. I mean, we have all sorts of pets using Maven, like healthy pets, pets with chronic conditions, pets that have recurring allergies, whatever it is, right? So, and we've proved our technology is beneficial for both populations, right? So we have use cases and patients that were completely healthy. Okay. And let me give you a specific example. Bella, 5-year-old a Labrador. Okay, she was with us for 5-6 months. Everything was okay. No thing to worry about. And suddenly we get reports of like being lethargic, vomiting, and we look for more information. And then we understood there was some high opacity for Bella as well. Okay, and so at this moment we triggered something. Okay, so that's something strange with this pet. You should go to the vet, and the outcome is a diabetes diagnosis. Okay, and now we know this pet is diabetes, right? Okay, so we'll be more tempted to like what's common for diabetes pets, right? And so we focus a lot on ophthalmologic problems. We focus a lot on vomiting. We focus a lot on the pet being lethargic. Okay, now we are even more granular on these specific cases. Okay, and for Bella, for 5 months, we were able to tell, okay, the medication is not doing effect. Okay, this pet keeps being lethargic. This pet keeps vomiting. The eyes are worsening. Okay, and so for the period of 5 months, okay, we kept telling the vet that the medication was not working. Okay, and it required like 4 adjustments for the pet to stabilize finally. Okay, and so just because we have data, because otherwise you go to the vet, your pet gets diagnosed with diabetes. Okay, you get medication, you go home. Okay, and maybe you have like an appointment scheduled for 3 months. Okay, and during this period of 3 months, you are like, the vet and the pet owner, you are like blind on what's going on. Okay, and we know how diabetes could be like severe and could impact like vision and they have other complications. Okay, and so just because we had data for the period of 5 months, we were able to tell, no, it's not there yet. The treatment is not working. Let's look at it again. Let's measure glucose on the blood again. And so this is the power of data. Okay, it's understanding not only for this case, we understood early there was a problem on a healthy pet. And the moment the pet gets diagnosed, we were able to tell, no, the treatment is not yet working. The treatment is not yet working. Okay, now the treatment is working. Everything is good. Pet is stable. Let's still monitor it, obviously. But for now, things are okay. So this is the power of data on the pet care industry. It's like, finally, we put like vets and pet owners in control of their pets' health, either healthy pets or pets that are already diagnosed or already as a condition. Maven can be like very valuable.
Yeah, that's huge. And you know, now that dog's nice and stable, like you say, keep that activity going, keep monitoring going, all the different parameters that you're measuring, because urinary tract infection comes along and it knocks out that balance of control, which unfortunately does happen. we can jump on it very quickly before it's a trip to the emergency vets, because everything is completely unraveled and things are in dire straits. So I guess, like you said at the very beginning, you're giving our pets the ability to speak almost, because we're able to interpret their behaviors into what we understand as problems, and how powerful that can be.
Yeah, speak is not talk, right? Speak is a way to communicate, right? There's different ways to communicate, right? And I do feel like technology, wearables, remote monitoring is the way for our pets to communicate.
Yeah, absolutely. And I think it's the way to it's the way to provide that next level of care that we all want, to get in there early before serious problems are. And I guess the added benefit from that I see is that if I have a patient brought to me much earlier stage, then maybe the diagnosis that I need to run are much less to come to the answer. The treatment given is much less and can be very much more specific, because I'm not dealing with all of these other factors that have crashed because of that condition. So actually it could be an awful lot, 1, more effective, 2, faster, and 3, cheaper. So isn't that what we all want for our animals? And cheaper vet bills, more effective communication and working with your vet. It's really a win-win, I think, all round.
Yeah, I'm told that a lot of times. So I touch different pains for not only for the vets, but for the pet owner as well, right? So you vets are busy, right? So I mean, your days are like running around from one side to the other, right? If you have data, if you have insights of what might be wrong, okay, you can streamline that case and focus on any other cases. At the same time, you will act early on, okay? So it's like less complicated solutions, less cases where you need to double down on different areas and try to understand how everything correlates and what that might be. And so it's definitely a win-win solution, like for everyone in the industry. Just because there's data. I mean, I was told several times that 80% of the job of a veterinarian is based on communication. Okay, and so
yeah.
I do feel there's a lot of room to put data into the mix, right? And put technology into the mix, and that it will only lead to like more accurate results, more accurate treatments, more accurate care at the end of the day.
Yeah, and a better quality of life, potentially a longer life for our furry family members, which is fantastic. Just thinking, Graham, about the practicalities. What it's a collar, like these things are worn on the collar. They are a collar. Are they bulky? What's involved for the pet parent to actually get this up and running and get this data collected? And then how is that data interpreted and communicated in a way to the pet parent or to the vet in a readily accessible manner that is easy to understand without having to, dive into graphs and all that kind of thing themselves?
Yeah, so it's a sensor. Okay, you can either get the sensor on your own collar, or you can buy our collar. It's up to you. Okay, and it's quite lightweight. It's quite small. We have like 3-4 pounds or 4 or 5 kilo cats using it like 24/7 and completely okay with it. So we've built it in a way that's comfortable for the pet, because it's supposed to be on the pet 24/7, right? That's the only way to detect like slight changes on a pet behavior. And so we are currently working with clinics. Okay, so if you are a pet owner and your clinic isn't yet using our technology, just put us in touch with them. And so we built what we call this AI vet, this artificial intelligence vet, which is like our technology that digests dozens of data points from the sensor, from the mobile app. It's dynamically looking for information based on evidences, and then transforms it and interprets it in a way that's less clinical significant for the vet. Okay, so we only tell the vet when something is wrong with one of their patients. Okay, and the pet owner also has the mobile app where they can see what their pet is doing. There's a timeline, weekly reports, daily reports, how the pet is sleeping, things like that. So pet owners also get a better understanding how their pet is doing, if something is changed. So they also keep an eye on it. Okay, but The goal with Maven is always to inform the vet early on when there's something wrong with one of their patients, okay? So that the vet can follow up with a pet owner as they see fit, okay? Either keep an eye on it, either grab the phone and call the pet owner, ask back at the clinic to readjust the treatment or to do more exams, something like that. And so, I mean, you can go to our website, maven.pet. There's all the information there, and it's really the peace of mind as pet owners have been waiting for a long time. It's now there, and it's possible.
Yeah, and how awesome is that? And I'm just thinking, even the fun features of, you know, how far has your pet gone, how many steps have they done, or whatever. However, that's hugely powerful as well, because we can if we gamify exercise, for example, like the biggest preventable health issue from my belief is obesity and being overweight. Yeah. And if we can just encourage more activity, and, you know, we all have our personal trackers, and it's, have I done my 10,000 steps or whatever your target is for the day, and, you know, you work hard to get there. Same for our pets. And if that can make them a little bit fitter and lose a little bit of that extra chub, then that's going to, even something as simple as that can have a huge benefit.
Yeah, we knew that. I mean, obesity is like it's an entry door for all sorts of problems, right? So we know that, and so we've built one of the first things that we've built at Maven. We call it like a zest score, which is like the perfect day for your pet. Okay, so this metric has all sorts of things on it: your pet age, breeds, lifestyle, chronic conditions, where you are, the previous data for your pet. And so, you know, you need to close the loop. You know, you need to get to 100 on your zest score to make sure that your pet has like the perfect day. Okay, it's not only activity; it's like in terms of the movement. There's like cognitive like playgrounds and things that you could do with your pet in terms of only cognitive. So it's not only exercise, and so all of that was with it's like a little game with the pet owner to make sure the pet has the perfect time. Okay, and if you grab two different pets and do the same walk, it will contribute differently for their Z score. Okay, because different pets require different exercise, different movement, different behaviors. And so we actually see people like engaging with a Z score. So if you reach home at 6 p.m. or 7 p.m. and you know the Z score it's still at 50, okay, you know you need to go for a bigger walk, or you know you need to play fetch with your pet to get to 100, right? And so this is a good way to start, like incentivize people to play with their pets and then exercise their pets, and making sure they are like playing around, or they are like entertained with something, because they need that as well, right? And so that was one of the first things that we built, precisely to tackle pets that are apparently healthy, okay, but they aren't, right? So we know that 60% of the pets, at least on the United States, are obese, and just being 10% over the ideal weight, like 10% into the obese zone, can reduce the lifespan of a pet for 2.5 years. Okay, people don't know this. People don't realize this. And so that was one of the first things that we built at Maven, because we knew how important it was. And yeah, people are engaging with it. People want to close the loops. People want to close the rings. People grab about that zest that it's now at 100%. And if they go hiking, okay, suddenly the zest it's 150, or it's a maximum. And that's lovely to see.
Yeah, and it's going to be good for us as well if we're trying to do that and go for the extra hikes and things. I love it.
Yes.
And I joke a lot that a lot of conversations end up with talking about obesity. It's so important. So we've ticked that box for this conversation as well. I guess, Graham, like the last thing that I wanted to talk about is, because us vets, myself included, sometimes can be quite old-fashioned and quite resistant to change and quite skeptical. So I think we need a lot of encouragement from our pet parents when they hear about these new fantastic options. Is that something that you come across? And I guess if it is, what would your tips be for trying to get people who are interested in using Maven and getting that integrated with their vet clinic? How can they go about doing that?
Yeah, so actually we have some situations where I mean, it happened both way, like a pet owner reaching out to a pet owner that uses Maven, okay, and suddenly the vets want to try Maven as well, okay? Because they had one of their patients that were on the clinic, like showing, look, this is Maven app, this is what's saying about my pet, and just the mobile app was useful for the vet, okay, and the vet got excited and curious and reached out to us, okay, and the other way around. So we have pet parents that start using Maven because their vet recommended. Okay, so that's the majority of where we spend our time, is like educating and working with vets, so they realize this technology out there and can be beneficial not only for them, okay, but for the pet owner and the pet, obviously. And so to start working with Maven, it's quite simple. Okay, so we do very quickly. I can do a demo, how things work, what the clinic gets. We built everything, so it's like effortless for the vet. Okay, I know how important this is. Okay, so people, your patients, pet owner just need to take one of the sensors, one of the kit home, set up everything, and we start collecting data. Okay, and then it's a matter of, when we understand that something is wrong early on, we will communicate with your vet, either by email, either by a pager system, either by text message, either by integrating with any of the softwares they already use, right? So it's like, it's effortless, okay, for the vet. So now you can have like 24/7 remote monitoring of all your patients, okay? Now you can have early detection of illnesses or wrong treatments, or treatments that are not being accurate, okay, effortlessly. Okay, so you will only need to act when Maven tells you that something is wrong, okay? And then obviously you should look at it and see which is the best way forward with the data point that we provided. Okay, so it's actually quite simple. We knew that veterinarians and doctors wouldn't have the time to look at charts and dashboards and things like that. If they want to double down, they can. It's there, okay, it's accessible. But the goal is like to quickly get a sense of if there's something wrong with one of our patients and what there is. Okay, so patient A has been lethargic, reporting vomit, and there's a disruption on sleep patterns. Okay, so I know everything that I need to do my job as a vet, right? And so that's how we built everything. So if you work at the clinic and want to give it a try, just let me know. Okay, g@maven.pet, as simple as that. We can book a demo, ship a couple of units, and start as soon as possible. If you are a pet owner, make sure that your practice, your clinic is already working with us. If not, you can put us in touch. And yeah, it's really a shift on the pet care industry. Just because of data. Okay, I can't stop saying this. Just having data. And day one that I work in the industry, I've been always telling people that we are blindly taking care of our pets. Okay, as pet owners, as vets, because it's true, right? So we just see the pets, and for the 10-15 minutes a consultation lasts, right? And so Maven can change that. Okay, Maven can change from 10-15 minutes a year, which is like the average people take their pets to the vet, to 24/7, and that it's immense value that will positively impact the industry.
Yeah, that's wonderful. I mean, it is really the future. The future is here now. I just had a thought pop into my head. You know, there's the TV show The Secret Life of Pets, and this is really kind of lifting the lid on that secret. It's letting us know what they're actually feeling, and allowing us to make a difference that I can't really overstate the importance of early intervention, and even just the peace of mind of knowing that your pet is healthy, that they're getting that great zest score, so they're living a mentally fulfilling life as well, which is another kind of bugbear of mine, the dog that's sitting there unstimulated at home, bored out of its mind and really not living its best life. So even for our well pets that stay well, we can really make measurable difference to their life, which is ultimately what we all want. So Graham, it's been a fantastic conversation. I'm super excited about this, as you can tell, and I can tell that we're kind of really touching the tip of the iceberg of what's possible. So watch this space. But thank you so much for your time today, and all of those links will be in the show notes, and I'm sure people will be reaching out and jumping on this pretty quickly.
Yeah, hope so. Thanks for the conversation, Alex. It's always super exciting talking about the pet industry and how technology could help.
And if you want to know just how important proactive healthcare can be for your pet, then make sure you check out this video on my vet-approved secrets to a healthier, happier life for your furry family member. So tap on that video, and until the next time, I'm veterinarian Dr. Alex. This is Our Pets Health, because they're family.